How do I heal granuloma without steroid injections? I have granulomas from Juvederm on both cheeks, which was confirmed by a biopsy. I have had both cheeks dissolved and have had steroid injections, which did not work but caused atrophy. Doctor wants to start PRP to heal the granulomas. Is that safe? If not, what's my best option? Please help.
Thank you for your question. You submitted 2 photos and you stated in your question that you've had biopsy-confirmed granulomas in your cheeks secondary to Juvederm, and that your doctor wants to use platelet-rich plasma to help with the healing of the granulomas, and you're concerned about atrophy or volume loss from the use of steroid injection. Well, I can certainly give you a little bit of perspective from my practice and my experience. I'm a board-certified cosmetic surgeon and fellowship-trained oculofacial plastic reconstructive surgeon, practicing in Manhattan and Long Island for over 20 years. The management of skin and other tissue with platelet-rich plasma is something I'm very familiar with. We use platelet-rich plasma every day in our practice. We've even developed a way to combine platelet-rich plasma with a material called acellular matrix for the treatment of hair loss. And I've used platelet-rich plasma in other modalities such as acne scars and scar tissue. And so I can certainly give you a little bit of perspective on how I would approach your situation, or at least a reflection on what your doctor is considering with platelet-rich plasma. You see, the challenge you're facing is that if the granuloma is treated further, or the nodule is treated further with some type of steroid injection or an anti-metabolite, there is a risk of further skin diminishing and attenuation or reduction, loss of fat, loss of dermis, and generalized atrophy. So the possible benefit of platelet-rich plasma could be indirect. As far as I'm aware, the literature doesn't show any evidence of direct improvement of granulomas with the use of platelet-rich plasma. Doesn't mean there may not be some benefit. Medical literature often lags considerably from clinical experience, and a lot of times clinical experience is not published in formal medical literature. So it's not out of the question to consider this. Platelet-rich plasma, briefly, essentially is a concentration of the healing and growth factors necessary for wound healing. And so when you think about it, what is wound healing about? You're stimulating blood supply, you're stimulating collagen. There is remodeling of tissue. So in a way, the platelet-rich plasma can have some role in improving the skin and under the skin tissue to improve the overall quality. Whether or not it fully resolves the granuloma, I think, would remain to be seen. I think that from a practical standpoint and a safety standpoint, I think you're in a safe place. Platelet-rich plasma is not likely to cause any harm as long as proper sterile technique is applied. There should be no risk of infection, and I think it is reasonable. A lot of times, the general medical community who's unfamiliar with platelet-rich plasma often looks at it negatively because they just don't know enough. But those of us who actually use it have a lot of good experience with it. And essentially, the safety is really unparalleled. And at the same time, the potential benefit, I think, we are continuously seeing. I've even noticed that even recently in the dermatology literature, platelet-rich plasma is becoming more prominent in terms of the benefits, especially for skin rejuvenation. In our practice, we use platelet-rich plasma routinely, speaking of that, to help people have glowing, nicer-looking skin. And part of that is, I think, the effect that platelet-rich plasma has on the collagen in the dermis, or the backbone of the skin, as well as the fatty layer under the skin. So there may be some potential benefit, and with relatively low risk, especially in comparison to using some kind of anti-metabolite. So I think you should have this discussion with your doctor, and I think close clinical observation is so important when you're doing something that's a little bit outside of the box. And so as long as your doctor is watching you closely and seeing how things are going and measuring and evaluating, you may have to be a little patient, but I think that there is value to considering platelet-rich plasma in the rehabilitation of your skin. So I hope that was helpful. I wish you the best of luck. Thank you for your question.